Hi, my name is Elizabeth Beemer. I'm a physical therapist at Methodist Physicians Clinic, Physical Therapy in Papillion. I'm going to show you some exercises today that you can do with a partner. Exercising with a partner is a great way to stay motivated and have a good time. So this is the partner heel tap exercise. So the standing person is in a slight squat and is holding a good core strength. And the person on the floor has a 90-degree hip and knee angle. And the band is just wrapped around his feet. And he's going to go ahead and tap his heels to the floor while the other partner holds the band steady. 8 to 10 repetitions, making sure to keep the legs in the same position. You can also do this one leg at a time to make it a little bit easier. We're going to be showing a tricep kickback exercise. So stand with your partner. You can do this with one arm or with both arms at the same time. We're showing you with both arms. So holding the bands in both hands, you're going to have your elbows a little bit behind your body, and then you're both going to extend your elbows and then bend them. And you can try that about 8 to 10 times. This is the chest press row exercise. So your partner stands in front and the partner is going to do a chest press while you pull and do a rowing motion. And you can do 8 to 12 repetitions. We're going to do external rotation, shoulder external rotation here. So they hold the band in their outside arm with their elbow tucked in at the side, and they're both going to externally rotate their forearm and then come back so the shoulder is rotating. 8 to 12 repetitions. So we're showing you floor slams with a medicine ball. You could use an exercise ball like these two are using right now, or you could use a more weighted medicine ball that weighs 2, 4, 6, or 8 pounds. This one just doesn't happen to bounce, so we're demonstrating with that one. But you bounce back and forth, reaching overhead, and then slamming the ball down into the floor, and then the partner catches. And again, you could do about 8 to 12 repetitions. This is the partner shuffle drill with the medicine ball. So they're just shuffling back and forth and tossing the ball back and forth between them. And you could go back and forth about 10 times or so. And you have to think about engaging your core a lot during this one. This is the partner squat exercise. You're going to grasp each other's forearms, and then you're going to just squat down and back up. And again, 8 to 12 times. Don't go past 90 degrees of knee flexion, and make sure you're keeping your back straight. It helps to do this one with somebody who's about the same size. This is the reach and touch plank. So you hold a plank position, and then you're going to reach towards your partner's shoulder, and you'll do opposite hands. So both reach that way, and then like so. And again, about 8 to 12. Make sure that you don't let your hips go too far up or too far down. This is the chest stretch. So this is a good cool down exercise. You can bring arms back and together until your partner tells you that you've gone far enough. And you just hold there for about 15 seconds or so to get a good stretch. And another cool down exercise is just a good hamstring stretch. So this is a real safe way to do a hamstring stretch. You want to hold above your partner's knee and on the calf, and you just gently press up until the partner says, that's a good stretch. About there.
That's fine.
Okay, and hold for about 10 to 15 seconds, or until the partner says, uncle. So in closing, remember to always communicate with your partner and talk to them if anything causes you pain. Make sure you stop and figure out what the problem is and fix it. Also, if you have any concerns, always check with your physician before you start any exercise program. And if you have questions or you just want more ideas, you can always contact Methodist Physicians Clinic Physical Therapy.